people?
Maayong buntag, kaigsunan.
Do you want a story, madlang people?
Gusto niyo ba ng istorya?
Are you following me? Okay.
Ginagaya mo ba?
You're naughty, but a second grade, trying hard, copy pig.
Isang bala ka lang.
Mahiwagang libro!
Ang mahiwagang libro, madlang people. Gusto niyo ba ng istorya?
Istorya! 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 Istorya!
May dalawang agent dumating sa Alien Monitoring Center na sina Agent X11 alias Labia at Agent X44 alias Quadruple. Pinatawag sila ng Supreme General. Pumasok sila sa magic door. Oh, may pinto. May pinto. At pagdating nila sa loob, nandyan na si Cookie. Gamit ang makapangyarihan nitong sayaw na nakakadulot ng airway obstruction, ay ginamit niya ito sa dalawang agent. Pero dahil sa gamit nilang suctioning weapon ng dalawang agent, mapupuksa nila si Cookie Korekok. Pero dahil gusto nilang tulungan ang kanilang Supreme General na nagamitan ng airway obstruction, ay pupunta sila sa planet Earth. Teleport.
Good day. We are going to show you on how to do the nasotracheal and oropharyngeal suctioning. Its purpose is to remove excess mucous membrane to maintain patent airway and collect sputum or secretions for diagnostic testing. Before we will do the suctioning, let's prepare the equipment needed in the suctioning. First, we need a sterile saline, we need a sterile glove, we need a towel, and a resuscitation bag. And after gathering all the equipment needed in the suctioning, let's have the assessment. Assessment in the respiratory system. We should note the rate, depth, and rhythm of our respirations, and note noisy, wet, or gurgling respirations. And we should also auscultate the breath sounds. Assess client's ability to cough, note for amount and character of the sputum, and assess vital signs to compare the baseline vital signs, and assess the patient's level of consciousness and ability to protect airway, and note any drainage from mouth. And after the assessment, next thing you will do is verify the physician order and identify the client to prevent potential errors. And after that, do the hand washing to prevent transmission of microorganisms, and explain the procedure to the client to reduce the anxiety and encourage cooperation with the procedure.
Sir, may I have the chart of Mr. Candy Ford? Candy Ford?
Yes, sir.
Thank you, sir. Thank you, sir. On the chart. Good afternoon, Mr. Stanley Ford. I'm Mr. Yurikin Torioni Norteza, a nurse from Sacred Heart Hospital. I'm here to do a procedure to you called suctioning. It will aid you in your breathing and suction the secretions if you're stuck in your throat. And sir, if you have any discomfort, just feel free to confront me.
Position the conscious client with an intact gag reflex in a semi-Fowler's position to help prevent aspiration of secretion. And after that, turn on the suction device and adjust pressure with 100 to 120 mmHg. And after that, open and prepare sterile suction catheter kit.
Sir, I will position you to a semi-Fowler's position, and then after that, I'll turn on the suction machine.
After open and preparing the sterile suction kit, pre-oxygenate the client with 100% hyperinflate with manual resuscitation bag to help prevent hypoxia.
Sir, I will pre-oxygenate you with so that to prevent complications like atelectasis and hypoxia.
After pre-oxygenating the client, don the sterile gloves to provide one glove in a dominant hand. The one hand may use a clean disposable glove on the non-dominant hand to protect oneself from exposure to mucous membranes and sputum. Having the sterile gloves, pick up the catheter with dominant hand. Pick up the connecting tube with non-dominant hand. Attach catheter to tubing without contaminating sterile hand. Place catheter and into cup of saline. Test functioning of equipment by applying top from non-dominant hand over open port to create suction. Return catheter to sterile field. Lubrication makes catheter insertion easier and assures proper functioning of suction equipment. After placing the catheter in the cup of saline, insert catheter into trachea through nostril, nasal trumpet, or artificial airway during inspiration. Inspiration opens epiglottis and facilitates catheter movement into trachea. Advance catheter until you feel resistance. Retract catheter 1 cm before applying suction. The nurse should note client usually will cough when catheter enters trachea. Apply suction by placing thumb of non-dominant hand over open port. Rotate the catheter with your dominant hand as you withdraw the catheter. This should take 5 to 10 seconds. Hyperoxygenate and hyperinflate using manual resuscitation bag for a full minute between subsequent suction passes. Encourage deep breathing.
Sir, you would inhale through your nose and exhale through your mouth, and do this frequently so that we could assess your breathing if it's okay. And if you would feel anything or that anything unusualities about your breathing, kindly refer it to us or just confront any of the nurse that will come in here. Thank you, sir.
After hyperoxygenating, rinse the catheter thoroughly with saline. After rinsing the catheter thoroughly with saline, repeat the steps 10 to 14 until airway is clear. Without applying suction, insert the catheter gently along one side of the mouth. Advance to the oropharynx. Apply suction for 5 to 10 seconds as you rotate and withdraw catheter. Allow 1 to 2 minutes between passes for the client to ventilate. Encourage deep breathing. Replace oxygen if applicable. Repeat steps 16 and 17 as necessary to clear oropharynx. Rinse a catheter and tubing by suctioning saline through. And after that, remove the gloves by holding catheter with dominant hand and pulling glove off inside out. Catheter will remain coiled inside the glove. Pull other glove off inside out. Dispose of in trash receptacle. After pulling off the glove off inside out, Patient should be hyperoxygenate. Turn off the suction device. Assist client to comfortable position. Offer assistance with oral and nasal hygiene. Replace oxygen device if used.
Sir, feel free to confront us on anything that you feel, and hopefully, sir, that there's nothing, hope for your fast recovery. Thank you, sir, for the cooperation.
And that's how to do the nasotracheal and oropharyngeal suctioning. That's all. Good day.
Solmux para sa ubo. Namimabisang offense para sa pagpili ng ubo. At defense para hindi mo balik ang ubo. Suction ng wall. Pag may offense, defense para sa iyo.
Welcome back to Showtime, madlang people! Nabitin pa kayo, madlang people! Show me your beautiful way! Gusto nyo pa ba na ikalawang storya? Istorya! 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 Mahiwagang libro! Pasok! Ang pamagat ng ating kwento ay Upa Banda Style. Mayroong isang banda na may 2 miyembro na drug addict. Addict ang mukha, addict din ang katawan. Addict dahil napakaingay ng isa. Magsa-soundcheck ang Upa Banda Style para magpakitang gilas. Gilas. dahil napakaingay ng isa sa kanila, magkakaroon ito ng napakalakas na ubo. At hindi na ito makapagsalita. At dahil dito, mapupunta ito sa ospital. Ospital.
Good day.
We will show you on how to do the chest physiotherapy, and its indications is to mobilize and eliminate secretions, re-expand lung tissue, and promote efficient use of our respiratory muscles in patients who expectorate large amounts of sputum, such as those with bronchiectasis and cystic fibrosis, and with those with artificial airway like tracheostomy or endotracheal tube. And chest physiotherapy helps prevent or treat atelectasis in bedridden clients and may also prevent pneumonia. The contraindications of chest physiotherapy is with active hemorrhage with hemodynamic instability and active pulmonary bleeding with hemoptysis and acute asthma or bronchospasm. Before we will perform the chest physiotherapy, we must also have prepare all the equipments needed for the procedure. We have here the kidney basin and a stethoscope.
Good morning, sir. I am Mr. Yurikin Leonin Norteza, a nurse from CPT Hospital. I am here to assist you in the procedure called chest physiotherapy. This will help you to aid or facilitate your breathing.
After explaining the procedure to the patient and provide privacy and perform hand hygiene, auscultate the patient lungs to determine baseline respiratory status and assess ability to clear secretions. Take note of where adventitious breath sounds are heard to determine affected lung segment.
Sir, you will now sit and breath position. I will assess your breath sounds using a stethoscope. When I say inhale, sir, will you inhale with your nose and exhale with your mouth? Inhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale.
After auscultating, perform postural drainage by positioning client properly, lung segment to be drained in uppermost. And we will perform the upper lobes posterior segments.
Sir, there are secretions in your upper lobe segments of your lungs, so you will be positioned in a sitting position with your hands on your legs. Then stay in that position, sir, for 10 to 15 minutes so that the drainage will be facilitated by the power of gravity.
Instruct patient to remain in each position for 10 to 15 minutes. During this time, perform percussion and vibration as ordered on area over affected lung segment. To perform percussion, instruct the patient to breathe slowly and deeply using the diaphragm to promote relaxation. Hold your hands in a cup shape with fingers flexed and thumbs pressed tightly against your index fingers. Percuss at each segment for 1 to 2 minutes by alternating your hands against the patient in a rhythmic manner. Listen for a hollow sound of percussion to verify correct performance of the technique. To perform vibration, ask the patient to inhale deeply and then exhale slowly through pursed lips. During exhalation, firmly press your fingers and the palms of your hands against the chest wall. Tense the muscles of your arms and shoulders in an isometric contraction to send fine vibrations through the chest wall.
Inhale. Exhale slowly, sir. Inhale. Exhale slowly.
After postural drainage, percussion, or vibration, Instruct the patient to cough to remove loosened secretions. First, tell him to inhale deeply through his nose and then exhale in 3 short huffs. Then have him inhale deeply again and cough through a slightly open mouth. 3 consecutive coughs are highly effective.
Sir, inhale, then exhale slowly with 3 consecutive cups. Like that, sir. 3 consecutive.
An effective cough sounds deep low and hollow, an effective one high pitch. Have the patient perform exercises for about 1 minute and then rest for 2 minutes. Gradually progress to a 10-minute exercise period 4 times daily. Provide oral hygiene because secretions may have a foul taste or a stale color.
Sir, you can now brush your teeth after the procedure. But if you have a mouthwash, you can gargle a mouthwash so that the foul smell from your mouth will be eliminated.
After providing oral hygiene, auscultate the patient's lungs to evaluate the effectiveness of therapy.
Sir, I will now auscultate the affected lungs so that we will evaluate if there are still secretions or the procedure done was effective. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Sir, the procedure is now finished and you can now return in your position, in your comfortable position.
오빤 강남 스타일 강남 스타일 낮에는 따사로운 인간적인 여자 커피 한 잔에 여유를 아는 품격 있는 여자 밤이 오면 심장이 뜨거워지는 여자 그런 반전 있는 여자 너는 선호해 낮에는 너만큼 따사로운 그런 선호해 커피 식기도 전에 원샷 때리는 선호해 밤이 오면 심장이 터져버리는 선호해 그런 선호해 아름다워 사랑스러워 그래 너 hey. 그래 바로 너 hey. 아름다워 사랑스러워 그래 너 hey. 그래 바로 너 hey. 지금부터 갈 때까지 가볼까 오빤 강남 스타일 강남 스타일 오빤 강남 스타일 강남 스타일 오빤 강남 스타일 Hey sexy lady 오빤 강남 스타일 Hey sexy lady 성숙해 보이지만 놀 땐 노는 여자 이때다 싶으면 묶었던 머리 푸는 여자 가렸지만 웬만한 노출보다 야한 여자 그런 감각적인 여자 나는 선호해 점잖아 보이지만 놀 땐 노는 선호해 내가 되면 완전 미쳐버리는 선호해 근육보다 사상이 울퉁불퉁한 선호해 그런 선호해 아름다워 사랑스러워 그래 너 오빤 강남스타일 강남스타일 오빤 강남스타일 강남스타일 오빤 강남스타일 Hey sexy lady 오빤 강남스타일 Hey sexy lady 뛰는 놈 그 위에 나는 놈 Baby baby 나는 more 좀 아는 놈 뛰는 놈 그 위에 나는 놈 Baby baby 나는 more 좀 아는 놈 You know what I'm saying 오빤 강남스타일 Hey sexy lady 오빤 강남스타일 Hey sexy lady 오빤 강남스타일 오빤 강남스타일